All right, welcome. If you're new to the world of apheresis, you're in exactly the right place. Today, we're doing a real deep dive into a life-saving procedure called lipid apheresis. We're going to break down what it is, why it's so important, and, this is the key part for you, how it all works, step by step. So let's jump right in. Okay, so first things first, let's look at why we even need this procedure. This image, this says it all, right? This is what we're up against. This is what happens when that bad cholesterol, LDL, just goes completely unchecked. It builds up, it clogs our blood vessels. It literally sets the stage for some really serious heart problems. This is the enemy. And lipid apheresis, well, that's one of our best weapons to fight it. So, here's how we're going to tackle this. First, we'll dig into the cholesterol problem itself. Then we'll define what lipid apheresis actually is. After that, the main event, a tour of the different methods. Then we'll cover the super important safety stuff, and we'll wrap up by looking at the huge impact this all has. Sound good? Let's go. All right, section 1, the cholesterol problem. Before you can really get your head around the how of any procedure, you've got to understand the why. So why is this so necessary? Who are the patients that really desperately need this?
Well, the main reason comes down to a condition called Familial Hypercholesterolemia, or FH for short. And this is so important to get. This has nothing to do with a bad diet or lifestyle. It's purely genetic. It means their bodies are just hardwired to produce dangerously high levels of bad cholesterol. And for these folks, you can throw all the best drugs at them and it's not enough. Their levels stay way too high. That's when they need something much more powerful.
And that something more powerful brings us right to section 2. What exactly is lipid apheresis? This is the solution we're here to talk about. The best analogy I've ever heard is this. Think of it like dialysis, but instead of for your kidneys, it's for your cholesterol. It's an extracorporeal procedure, which is just a fancy way of saying we do the work outside the body. We take the blood out, the machine specifically targets and pulls out the bad stuff, that LDL cholesterol and another little troublemaker called lipoprotein A, and then sends the cleaned up blood right back to the patient. It's pretty amazing.
Okay, now we're getting to the core of it. Section 3, a tour of the methods. This is where we get into the nitty-gritty, the machines, and the actual techniques you'll be using. So, how does this whole cholesterol dialysis thing really work on a practical level?
So, when you look at all the different systems out there, they basically fall into two big categories. On one hand, you've got your whole blood treatments. A good example is the DALI system. It does exactly what it sounds like. It treats the whole blood, just as it is. Then, on the other hand, you have plasma-based treatments like HELP or DFPP. With these, the first step is always to separate the plasma. That's the liquid part of your blood from the blood cells, and then you just treat the plasma.
Okay, let's start with a whole blood system. So how does that DALI method actually work? Let's break it down. It's actually a really clever and pretty straightforward process. The patient's blood is pumped through this special column you see here, called the DALI adsorber. Now, the best way to picture this is as a kind of sticky trap specifically for bad cholesterol. Here's how it works. The surface inside this column has a negative charge. The bad lipoproteins, they have a positive charge. And what do opposites do? They attract. It's basic physics. The LDL literally gets stuck to the column, and the now cleaner blood just keeps on flowing through. Okay, now for some absolutely critical details if you're ever running a daily system. First, that absorber column, it's one and done, single use only. Second, you have to use an anticoagulant, ACDA, to keep the blood from clotting in the circuit. But listen up, because this next part is the most important takeaway. You must, and I can't stress this enough, you must give the patient a calcium infusion during the treatment. Why? Well, both that anticoagulant and the absorber itself can grab onto calcium and pull it out of the blood. If you don't actively replace it, their calcium levels can plummet, and that's dangerous. This is absolutely non-negotiable. All right, so that's a whole blood system. Now let's switch gears completely and look at a plasma-based one. The HELP system uses a totally different trick. So how does it get the job done? It's not about electric charges, it's all about chemistry. So with the HELP system, step 1 is separating the plasma from the blood cells. Now you've just got this yellowish liquid. Then you mix that plasma with heparin and you lower the pH to make it more acidic. This creates a chemical reaction that causes the bad stuff, the LDL and LPA, to precipitate. Basically, it makes them turn from a dissolved liquid into tiny solid particles. And once they're solid, well, they're super easy to just catch in a filter. After that, you just rebalance the plasma's chemistry and send it back to join up with the blood cell. Now, just a quick but important note on two other methods you might hear about, DFPP and cascade filtration.
They sound kind of similar, but there's a key practical difference you need to know. Both of them separate plasma first, but how they do it is different. DFPP uses a secondary filter. Cascade filtration uses a centrifuge. The big takeaway for you? This usually means you can do the whole DFPP procedure with one machine, whereas cascade filtration often needs a second piece of equipment for that centrifuge step.
Okay, you've got the mechanics down, but now we're moving on to what is, without a doubt, the most important part of your job. Section 4, Safety and Side Effects. This is the stuff that every single technician has to be watching for every single time.
So the first thing to know is that overall, this is a very safe procedure. Most of the side effects you're going to see are pretty mild and totally manageable. If you look at the table, you'll see the usual suspects pop up for the different methods. A little drop in blood pressure, maybe some nausea, feeling tired. These are common. The key is that you are there to monitor the patient constantly and know exactly what to do when they happen.
And just to give you some perspective on the real risk, what about serious side effects? The kind that might require a hospital stay? Well, the rate is incredibly low. We're talking less than 1%. So while we always have to be prepared for anything, it just goes to show you how safe and well-established these treatments really are.
All right, let's bring this all home. Section 5, the big picture impact. We've talked about the tech, we've talked about safety, but this is why it all matters. This is the why behind all the work.
And I mean, just look at these numbers. The results speak for themselves. In just one session with a system like DALI, you can see about a 71% drop in bad cholesterol, a 64% drop in LPA. These are not small tweaks. This is a dramatic, immediate, life-changing impact that, for these particular patients, you just can't get from pills alone. It's incredible.
When you boil it all down, it comes back to this one powerful truth. The earlier the diagnosis, the greater the survival with early treatment. It's that simple. And people like you, the technicians running these machines, you're on the absolute front lines. You're delivering that aggressive, early treatment that literally gives people more time and better health. So I want to leave you with one last really important question. It's not just for me, it's for you as you start out in this field. We have this amazing technology. We know it's safe and we know it works. So what's the next big hurdle? It's awareness. How do we make sure that every high-risk patient who could benefit from this actually knows about it? How do we get the word out? That's the mission now. Thanks so much for joining me.